Autism spectrum disorder and attention deficit hyperactivity disorder are two of the most commonly diagnosed neurodevelopmental conditions affecting millions of children and adults worldwide. Understanding these conditions is crucial as their prevalence continues to rise and their co-occurrence becomes increasingly recognized. Autism Spectrum Disorder, or ASD, is a complex neurodevelopmental disorder that affects how individuals communicate, interact socially, and process sensory information. The term spectrum reflects the wide range of symptoms and abilities that people with autism can have. ASD is characterized by persistent deficits in social communication and interaction across multiple contexts. This includes challenges with social emotional reciprocity, nonverbal communication, and developing and maintaining relationships appropriate to developmental level. Additionally, individuals with ASD display restricted, repetitive patterns of behavior, interests, or activities. This can include repetitive motor movements, insistence on sameness, highly focused special interests, and hyper or hyporeactivity to sensory input. Attention deficit hyperactivity disorder, commonly known as ADHD, is another neurodevelopmental disorder that significantly impacts daily functioning. ADHD affects the brain's executive functions, which control attention, behavior, and emotions. ADHD is characterized by three core symptom domains. Inattention involves difficulty sustaining focus, being easily distracted, and struggling with organization. Hyperactivity manifests as excessive movement, restlessness, and difficulty sitting still. Impulsivity involves acting without thinking, interrupting others, and having difficulty waiting turns. For a diagnosis, these symptoms must be present before age 12 and cause significant impairment in multiple settings. The co-occurrence of autism and ADHD is increasingly recognized in clinical practice. Research shows significant overlap between these conditions, with many individuals receiving dual diagnoses. Studies indicate that more than half of individuals diagnosed with autism spectrum disorder also show signs of ADHD. Conversely, up to 25% of children with ADHD exhibit low-level signs of autism spectrum disorder. Current estimates suggest that approximately 40% of children diagnosed with autism will also receive an ADHD diagnosis, highlighting the importance of comprehensive assessment and understanding of both conditions. The prevalence of both autism and ADHD has increased dramatically over the past 2 decades. This graph shows the rising autism prevalence rates from 2000 to 2020, demonstrating a significant upward trend. Current data from 2020 indicates that 1 in 36 children aged 8 years is estimated to have autism spectrum disorder. This represents a substantial increase from 1 in 150 children in the year 2000. For ADHD, approximately 10% of children and adolescents aged 4 to 17 years were diagnosed between 2017 and 2022. This means roughly 1 in 10 children is affected by ADHD, making it one of the most common neurodevelopmental disorders. The growing prevalence of autism and ADHD has significant implications for healthcare systems and society. The U.S. ADHD and autism clinics market was estimated at $65.13 billion in 2023. This market is projected to grow at a compound annual growth rate of 8.56% from 2024 to 2030, driven by the rising prevalence of both conditions and increasing demand for specialized services. Several factors contribute to this growth, including increasing prevalence rates, growing awareness leading to earlier diagnosis, expanding treatment options, and rising demand for specialized care tailored to individuals with autism and ADHD. Understanding autism and ADHD as neurodevelopmental disorders is crucial for developing effective interventions, supporting affected individuals and families, and addressing the growing healthcare needs in our communities. Autism and ADHD share many overlapping symptoms, making them challenging to distinguish and often leading to co-occurrence in the same individuals. These two neurodevelopmental conditions have significant overlap in their symptom presentations, creating a complex intersection that affects diagnosis and treatment. Research has identified 5 primary areas where autism and ADHD symptoms overlap significantly. These shared characteristics include language delays, heightened sensory responses, defiant behavior, emotional regulation difficulties, and problems with executive functioning. Language development delays are common in both conditions. Children may experience late onset of speech, difficulty understanding social communication rules, and challenges in maintaining conversations. These delays can significantly impact academic and social development. Sensory processing differences are prevalent in both autism and ADHD. Children may be hypersensitive to environmental stimuli like sounds or textures, or they may seek intense sensory input. These responses can lead to behavioral challenges and difficulty concentrating in typical environments. Emotional regulation presents significant challenges in both conditions. Children struggle to identify, understand, and manage their emotions effectively. This can result in intense reactions, meltdowns, and difficulty recovering from emotional distress, impacting relationships and learning. Executive functioning deficits affect both conditions significantly. These include difficulties with planning, organization, impulse control, working memory, and cognitive flexibility. These challenges impact academic performance, social relationships, and daily life skills. The co-occurrence of autism and ADHD is remarkably high. More than half of individuals diagnosed with autism also show signs of ADHD. Conversely, up to 25% of children with ADHD exhibit low-level signs of autism. Most significantly, 40% of children diagnosed with autism will also receive an ADHD diagnosis. This high level of co-occurrence has significant implications for diagnosis and treatment. Until 2013, diagnostic guidelines prevented clinicians from diagnosing both conditions in the same individual, leading to misdiagnoses and inadequate support. The presence of both conditions significantly complicates treatment approaches. ADHD medications often show reduced efficacy in autistic children, and standard behavioral interventions may need substantial modifications. This necessitates highly individualized treatment plans that address the unique presentation of each child. Understanding these overlapping symptoms and high co-occurrence rates is crucial for accurate diagnosis and effective treatment planning. The complex interplay between autism and ADHD requires specialized knowledge and individualized approaches to support affected individuals effectively. Understanding the genetic and neurobiological foundations of ADHD and Autism Spectrum Disorder reveals why these conditions often occur together and how they affect brain function. Both ADHD and Autism Spectrum Disorder have strong genetic components. Research shows that these conditions run in families, with heritability estimates ranging from 70 to 90% for both disorders. Family studies reveal striking patterns of inheritance. When one family member has ADHD or autism, other relatives are significantly more likely to have these conditions or related traits. Both conditions significantly impact executive functioning, which is primarily controlled by the prefrontal cortex. This brain region acts like a conductor, coordinating input from other brain areas to manage complex cognitive processes. The neurobiological basis of these conditions involves complex interactions between multiple brain networks. Structural and functional differences have been identified in areas responsible for attention, social communication, and sensory processing. Recent research has highlighted the importance of epigenetic mechanisms in ADHD and autism development. These modifications can alter gene expression without changing the DNA sequence itself, providing a bridge between genetic predisposition and environmental influences. Understanding these genetic and neurobiological factors is crucial for developing targeted interventions and personalized treatment approaches. The interplay between genes, brain development, and environment creates the complex presentations we see in individuals with ADHD and autism. Diagnosing autism and ADHD requires comprehensive assessment processes that evaluate specific behavioral patterns and developmental criteria. These diagnostic procedures have evolved significantly and face increasing demands in healthcare systems worldwide. The diagnostic process follows a systematic approach involving initial screening, comprehensive clinical assessment, detailed behavioral evaluation, and final diagnosis with treatment planning. Autism assessment follows a structured pathway involving multiple stages. The process evaluates core areas, including social communication deficits, interaction challenges, and restricted repetitive behaviors, along with sensory processing differences and developmental history. Autism diagnosis focuses on identifying specific behavioral patterns. These include difficulties with social interactions, communication challenges, repetitive behaviors, and obsessive interests. Sensory repetitions and fixations are also key indicators that clinicians assess during the diagnostic process. ADHD diagnosis follows DSM criteria focusing on three core symptom domains: inattention, hyperactivity, and impulsivity. The assessment must demonstrate that symptoms occur across multiple settings, significantly impair functioning, and began before age 12. Diagnostic overshadowing is a significant challenge where clinicians' familiarity with one disorder may cause them to focus on its defining characteristics while overlooking symptom overlap with other conditions. This can result in missed co-occurring diagnoses and inadequate treatment planning. Healthcare systems face unprecedented challenges in autism and ADHD diagnosis. Long waiting lists have developed due to increasing demand for assessments. Diagnostic processes continue evolving as our understanding improves, while healthcare resources remain strained. Statistics show that 40% of autistic children also have ADHD, with prevalence rates of 50 to 70% for ADHD in individuals with autism spectrum disorder. Effective diagnosis of autism and ADHD requires comprehensive assessment protocols that address the risk of diagnostic overshadowing while managing increasing demands on healthcare systems. Continued improvements in diagnostic processes and resource allocation are essential for providing timely, accurate diagnoses. Both autism spectrum disorder and ADHD are spectrum disorders, meaning they present very differently across individuals. Understanding these variations is essential for providing appropriate support and interventions. The term spectrum reflects the wide range of symptoms, skills, and levels of support that individuals may need. No two people with autism or ADHD are exactly alike. Autism spectrum disorder is categorized into three levels based on the amount of support an individual requires in their daily life. Level 1, requiring support, includes individuals who may struggle with social communication, but can function relatively independently with some assistance. Individuals at Level 1 may have difficulty initiating social interactions and show decreased interest in social engagement. Their inflexible behaviors can significantly interfere with functioning in various contexts. Level 2 individuals require substantial support. They have marked deficits in communication skills, and social impairments are apparent even when supports are in place. They often have difficulty coping with change. Level 3 represents individuals requiring very substantial support. They have severe communication deficits, very limited social interaction initiation, and extreme difficulty coping with change or other stressors. ADHD presents in three distinct ways: predominantly inattentive, predominantly hyperactive impulsive, and combined presentation. Each has unique characteristics and challenges. The predominantly inattentive presentation is characterized by difficulty sustaining attention, being easily distracted, forgetfulness in daily activities, and problems organizing tasks and activities. The hyperactive impulsive presentation involves excessive fidgeting, difficulty remaining seated, acting as if driven by a motor, and frequently interrupting or intruding on others. The combined presentation is the most common form of ADHD, where individuals meet criteria for both inattentive and hyperactive impulsive symptoms. This is often the most challenging presentation to manage. Even within the same subtype or support level, individuals show remarkable variation. Each person has different strengths, varying challenges, unique support needs, and individual responses to interventions. Understanding these variants and subtypes is crucial for developing effective, tailored interventions. Comprehensive assessment determines individual needs, interventions must match specific challenges, and regular monitoring ensures optimal outcomes. By recognizing that autism and ADHD exist on spectrums with distinct presentations and individual variations, healthcare providers educators, and families can work together to provide the most appropriate and effective support for each person's unique needs. Managing autism and ADHD presents unique challenges, especially when both conditions occur together. Currently, there are no standard treatments specifically designed for the combination of autism and ADHD, making individualized approaches essential. Pharmacological treatments form a cornerstone of ADHD management. Stimulant medications like methylphenidate and amphetamine-based drugs are first-line treatments, while non-stimulant options include alpha-2 agonists and certain antidepressants. Non-pharmacological treatments are equally important, particularly for autism spectrum disorder. Applied behavior analysis, or ABA, is one of the most widely used evidence-based interventions. It focuses on improving specific behaviors and teaching new skills through systematic reinforcement. The future of treatment lies in personalized healthcare approaches. Rather than using one-size-fits-all treatments, advances in genetic research and autism subtyping are enabling clinicians to tailor interventions to individual needs and characteristics. Emerging technologies are revolutionizing treatment approaches. Artificial intelligence and extended reality technologies are creating new possibilities for skill building, communication support, and daily living assistance. Virtual reality environments can provide safe spaces for practicing social skills and managing sensory sensitivities. Effective management requires an integrated, multidisciplinary approach. Treatment teams typically include physicians, psychologists, behavioral therapists, and educational specialists working together. The key is combining evidence-based interventions while continuously monitoring and adjusting strategies based on individual response and changing needs. The field of autism and ADHD research has experienced remarkable progress in recent years, with groundbreaking advances across multiple domains, including genetics, technology, and diagnostic methodologies. The year 2024 has marked significant milestones in autism and ADHD research, with advances spanning genetic discoveries, technological innovations, diagnostic breakthroughs, and critical investigations into social inequities affecting access to care. Gene-targeted therapies represent one of the most promising frontiers in autism treatment. Researchers have made significant strides in developing personalized medicine approaches that target specific genetic variants associated with autism spectrum disorders. Emerging technologies are revolutionizing skill building and communication support for individuals with autism and ADHD. Artificial intelligence and extended reality platforms are creating unprecedented opportunities for personalized intervention and daily living support. Innovative diagnostic approaches are transforming early detection capabilities. Stool analysis and microbiome research have revealed significant connections between gut health and neurodevelopmental conditions, opening new pathways for early screening and intervention. Research into social inequities has become a critical priority, examining how diagnostic disparities and access barriers affect different communities. This work is driving system-level interventions to ensure equitable access to autism and ADHD support services. Telehealth has revolutionized ADHD treatment accessibility, with studies showing no significant difference in safety outcomes between telehealth and in-person stimulant treatment initiation. This has dramatically expanded access to specialized care, particularly for underserved populations. The growth of autistic-led research represents a fundamental paradigm shift, ensuring that research priorities align with community needs and lived experiences. This approach is producing more relevant and impactful findings that directly benefit the autism community. These research advances are collectively transforming our understanding of autism and ADHD, leading to more personalized interventions, improved accessibility, and greater equity in care delivery across diverse populations. The future of autism and ADHD research holds tremendous promise. Current trends indicate a shift toward personalized healthcare approaches, with advances in gene-targeted therapies and autism subtyping driving individualized treatment plans. A critical challenge facing the field is addressing significant inequities in diagnosis and access to care. Research shows substantial disparities across different populations, with some communities experiencing delayed diagnosis and limited access to support services. Early identification and intervention have become increasingly recognized as crucial factors in improving outcomes. Research shows that children with autism and ADHD have significantly more doctor and hospital visits during infancy, providing opportunities for earlier detection. Creating inclusive and supportive environments is essential for individuals with autism and ADHD to thrive. This includes implementing evidence-based accommodations in educational settings, workplaces, and communities that recognize and support neurodiversity. The future holds great promise for individuals with autism and ADHD. Through continued research, addressing systemic inequities, early intervention, and creating truly inclusive environments, we can build a world where neurodiversity is not just accepted, but celebrated and supported.